Hello. The other day I was watching a video of a MAGA lady on YouTube, and she claimed that she hated Europeans because we have free healthcare here in Europe. So I would like to talk about that today. My name is Caroline, and I would like to welcome you to a new episode of my podcast, One Opinion from Europe. I would like to take a closer look at her statement. I must admit I found it quite off-putting. Firstly, just from a pure personal point of view, it seemed quite venomous, and it just isn't the way that I think, that if somebody else has something that's good, I don't hate them because they have it. And if it's something which I would covet, I don't know, if they have a new car or something, and I think I would like to have a new car, well, then I try to see and find how I could get to have a new car. But what was really off-putting for me was her complete ignorance. And also, not just the ignorance, there's many things I don't know, but her lack of curiosity to find out whether that was right. And she was there with her chest puffed out and with her indignation. And so I thought, well, today I think I ought to clear this up. And so I would like to take a little time to have a look at our German healthcare system. It's definitely not perfect, but other countries in Europe also have different types of system, but the German one is the one I know best. So I'll take you through an example of how the healthcare insurance works in Germany, who pays what. There is no such thing as a free lunch, and healthcare does cost a lot of money. But for us here in Germany, it is regulated, and although the price of it may go up, it will be very slight changes. The German healthcare system, I believe, is one of the oldest ones in the world. It was started by Graf von Bismarck in 1883, and originally there was only coverage for about 10% of the population, and those were the low-income people. Anyway, the whole system developed, and ultimately the health system became, the coverage spread over more people, and it even survived 2 world wars. It survived several currency devaluations, and it also survived the reunification of Germany in the 1990s. So where we are today is that healthcare insurance is actually mandatory here in Germany. You have to have health insurance, and there are typically 2 types of insurance you have. 90% of the population has a statutory insurance, and there's 10% of the population has a private insurance. These people are mainly those who have a higher income, and also those people who are freelancing. So if you're working as a plumber on your own accord, then you would need to go into a private insurance scheme. There are maybe a few advantages of the private scheme. It is more expensive, but you do have a few advantages, maybe in dental care, or if you're looking for glasses, you might get more of a contribution. But generally, the 2 systems, the basic coverage is the same. So, for example, if you are covered by the statutory state system of health insurance, you can go to the doctor anytime. You can go to a doctor of your choice. You may have to pay a slight contribution if you have a prescription. I think it's about €5. But other than that, there aren't many things that you have to pay on top. You might have a slightly longer waiting time than those who are covered by the private insurance, because the doctors actually earn more from the privately insured ones. But when it is something serious, then there is no difference between the 2 systems. For example, my son's father-in-law, he just got a serious diagnosis. He has a tumor in his bladder, and he got that about a month ago. And so far he has had 2 exploratory operations, and only just this week he got the final diagnosis that it is malignant and the tumor is too large to be cut out. So he's being put into chemotherapy straight away. Now, as you can imagine, for our family, for his friends, This was quite a shock to all of us, and we all rally round and try and help his wife and try and, bolster up his courage a little bit. He'll get through it, etc., etc. He's only 66. But what is strikingly different, and I was talking to my son about it the other day, as compared to the US system, we don't have to worry about costs. I would not have to sell my house to be able to help him pay his chemotherapy bills. He has been a manual laborer for all his life. He has worked very hard, but he has no significant financial reserves. So if he had to pay for this treatment himself, he would not be able to do it. Also, his wife recently, I would say over the past 5 years, she's had 2 knee replacements and a hip replacement. That is all quite standard and covered by the statutory insurance. Also followed by 3-week rehabilitation each time to get you up and running. So it is a very good system. Okay, many people complain about this and that. They might have to wait a little bit longer than they would like to or whatever. But from the financial perspective, the German healthcare system, I think, is a good system. If you take a look in England, they have the NHS. The actual method is slightly different to here in Germany, but the NHS in England is chronically underfunded. I know that my brother said he would have had to wait something like a 2-year waiting list to have a knee replacement done. He eventually had it done privately. So there are differences between the different countries. I would briefly like to run you through how we actually pay for our health insurance. It is a deduction from our salary. So anybody who is employed here in Germany, as I say, it is mandatory, and the employer actually takes the deduction out of the monthly salary. So if you have, for example, a monthly salary of 5,000 euros, you would be taxed at that level. It would be about 15 or 16%. You would pay taxation. We have a progressive method of taxation here in Germany, so you pay more tax the more you earn. And then you have all the social security deductions. You have the pension insurance, which is about 9.35%. Then you have the health insurance deduction. Now every employee decides into which fund he wants to go. Some are slightly more expensive, some are slightly cheaper, some are more focused on certain illnesses or maybe certain groups of work. So you choose your health fund, but the actual rates are not significantly different. So in this case, we have a health insurance deduction of 8.75%, that is 438 euros. We also have, for the past 30 years, another deduction called a long-term care insurance deduction, which is about 2.4%. This covers you in later age. For example, when my father went into an old people's home, at least half of his monthly fee at the home was paid through this insurance. Also, if you are actually caring for a parent at home, you are liable, just as the home would receive a contribution from this insurance, you would actually get a reimbursement from this insurance fund if you are caring for your own parent. And then, of course, we have unemployment insurance, which currently is 1.3%. Now, what happens with these deductions is that these are effectively doubled up by the employer. So the actual cost of the health insurance is for the employee 8.75%, but the employer also pays 8.75%. It's the same with the pension insurance and the unemployment insurance and the long-time care insurance. So that is how it actually works here in Germany. Now, although I think the German healthcare insurance system is very good, there are a few disadvantages. I don't think there is such a thing as a perfect system. So in the example of Germany, there are 2 basic issues at hand. Now, if you have been in the private system, for example, and you've reached the age of 55, you have to make a decision as to whether you want to go back into the statutory system or whether you want to continue with your private healthcare. In my example, I am actually privately insured, and at the age of 55, I was still earning a very good income. So I decided to stay in the private health insurance, and I cannot now go back into the statutory insurance, which is actually significantly cheaper. So that is a slight disadvantage, and it is currently going through the courts here in Germany because it just seems completely illogical. Because up until the age of 55, you can always switch between the two as long as you meet the criteria for being in the private system. But I think the second disadvantage is more concerning. That is that people do fall through the cracks. For example, if you are in the private insurance because you are a freelancer, maybe you're a journalist or whatever, and you're going through a hard time and financially you are completely strained and you are not able to keep up with the healthcare payments, then you can be actually thrown out of your coverage by the health insurance company. The law actually says they have to take you back once you say, I'm doing okay now, I want to get back into the system. But the disadvantage is that the German health insurance laws say you have to do all the back payments back until when you stopped paying. So this is a huge deterrent for people to get back into the system once they have got back onto their feet financially. And it is estimated that maybe up to 1 million people here in Germany have actually fallen into this crack and are uninsured, which of course means that if something serious does happen, they would have to pay for it themselves or just not get the treatment. There are a few hospitals here in Germany who actually treat uninsured patients, but they are very much the exception than the rule. Now, finally, I would just like to wrap up with my thoughts on this because, as I mentioned, for me, I just cannot understand the US healthcare system. It seems to be a hodgepodge of all different types of things. You have Medicare, you have Medicaid, you have people now having to pay double their premiums, which in some cases probably is not possible. And I remember that when there was a debate between Donald Trump and Kamala Harris, and she was having a go at him for saying that he would never come up with a healthcare system, and he would say, yeah, but I have a concept of a plan. And I was thinking, well, is it that difficult to get a concept of a plan? Nearly all civilized, well-developed countries have a statutory health insurance plan. Why can't America just copy and paste? I know that's very simplified, but for me, such a progressive, rich, developed country, it's incomprehensible that there is no such thing as a public healthcare system. I was brought up in England, and as I mentioned before, I was under the NHS. It's not a perfect system, as I say, it's chronically underfunded today. But for me, it was just natural to go to a doctor when and if I had something. So those are my final thoughts on healthcare insurance. I hope this has been interesting for you today. If you have enjoyed it or if you are interested to hear more, please leave a like or even a subscription. I would be happy to answer any of your comments or suggestions that you may have and look forward to the next time. Take care. Bye.